Alberta Health Services. Healthy Albertans, healthy communities, together.
Good afternoon, everyone. I'm David Wyant, Chair of the Alberta Health Services Board. I would like to acknowledge that we are gathered today on Treaty 7 and Métis Region 3 territory, a traditional meeting place and home for many Indigenous peoples. To start, I would like to say a few words about the Ernst & Young report commissioned by Alberta Health, which was released earlier this month. The report states that Alberta's provincial healthcare model is one that deserves great praise. The report confirms that Alberta leads the country on several nationally reported indicators, and that in many ways, Alberta's care delivery model is ahead of its provincial peers. The report also gives the organization an impressive array of recommendations and opportunities designed to aid in continuing to build a more efficient, sustainable, and innovative healthcare system. In our view, not all of the cost savings identified in the report are achievable or even desirable, and many of them will take years to bring to fruition. The report cautions that the task ahead of us is not simple. That said, we are committed to using the report as a tool to assist us in finding efficiencies in our system while we continue to improve patient outcomes. In fact, it should be noted that more than half of the opportunities outlined in the report are already underway in some form or another. Dr. Yu will talk about some of that work shortly. To move forward with the report's recommendations, AHS has assembled a team that will develop an implementation plan for the next 3 years. And that plan will be delivered to the Minister of Health on May 13th. After delivery of the plan, we will continue to work with the Ministry and other stakeholders in the best interests of Albertans. And at the end of the day, this is all about Albertans. As AHS looks ahead to its second decade, the AHS Board, our executive, and the senior leaders are all focused on ensuring the provincial health system is strong and sustainable, and that Albertans receive outstanding care now and for generations to come. So before I ask Verna to speak, some formal business. Do all board members have before them the agenda? May I ask that someone move approval of the agenda? Hugh, thank you. Second? Thank you, Glenda. All in favor? Opposed or abstentions? Carried. Thank you. Based on the approved agenda, does anyone have a conflict of interest to declare? Seeing none, we will continue. You've all seen the minutes from our previous meetings. We have minutes for our board meetings on November 28th, December 11th, and February 13th. May I have a motion to approve each of those 3 sets of minutes? Thank you, Heidi. Second? Thank you. Thank you, Glenda. Any comments, additions, changes? Okay. All in favor of approval? Thank you. And there are no abstentions. There's no one else here. No one on the phone. Thank you very much. I think that brings me to the end of the formal business now, and to Verna.
Great, thanks very much, David, and good afternoon to everyone. I've talked in the past about our ongoing efforts to offer more community-based care. And today I'd like to share a video featuring another one of our programs that does just that. It's called Hospital at Home, and it's based out of the Alberta Children's Hospital. As the program's name suggests, it brings hospital-level care to the home of young patients and their families, much similar to other programs that we are doing in terms of providing care at the homes to adult patients. So please take a look at the video.
When we heard we were going to have a baby, we were very excited.
So it's a moment of my life that I'll probably never, you'll never forget.
All along, we were told that we were going to have a healthy baby. He was such a happy, healthy baby. He was eating, he was thriving. It was the beginning of October. I thought I'd felt something in his abdomen. We went to see a physician about it. He had felt it as well, and so they arranged a emergent ultrasound. They found a quite significant mass in Sawyer's abdomen. We knew at that point that he had cancer. When they told us it would be a year and a half, I just remember I was laying on the ground crying because I'm like, I cannot do this for a year and a half. I knew right away that hospital was really challenging for us.
Hospital Home was introduced in 2012. We were looking for a way to bring family center care into patients' homes. That is offered to patients that come through our hematology, oncology, immunology, blood and marrow transplant clinic at the Children's Hospital. Most of our home visits are for chemotherapy. One of our other big services is giving IV fluids in the home.
You're in the comfort of your home. He sees the same 3 or 4 nurses every week that when they come to the home. It's those same 3. He has a bond with them. It saves time. He gets to play with his toys. He can have a nap.
We also can do a lot of teaching in the home for families and parents who need to learn complicated things to care for the children at home.
Hospital at Home has really helped us feel better about doing these things as parents and slowly introducing us into this new life that we would have to live.
The younger patients receive the benefit of routine. So they're able to have their naps throughout the day. They are able to eat the foods they like at their home, and mom and dad are close by.
And when you're at home, it feels more of it's a natural setting. And it kind of takes your mind a little bit away from the fact that he has cancer.
Sawyer doesn't sleep at the hospital. It's very stimulating for him. Being at home has really allowed him to maintain a schedule, get some rest, and try and heal and recover as much as possible. He's very brave.
Strong.
Yeah, he's very strong. He definitely makes us stronger.
Yeah, sometimes I feel like it's the other way around, where he's getting us through this and not us getting him through this treatment.
It's really true. Yeah, he's definitely been our rock, actually. And the hope is that he'll be cancer-free, and that's, I think, the hope of not only ourselves but the healthcare providers and the team at the Children's.
Together, we do amazing things every day.
So Sawyer continues to receive care both in the hospital but also in the home setting. And he can receive care in the comfort of home when that's possible. And as you could see, this arrangement is not only good for Sawyer, but it's good for his family, and it's good for our healthcare system. Hospital care is the most expensive care in any healthcare system. So by providing equivalent care that's safely outside of the hospital, not only do we save money, but it eases our capacity pressures, and at the same time gives patients and families a much more comfortable and convenient home experience. And before I hand the mic back to Dave, I'd like to mention just a couple of items. There continues to be a lot of news about coronavirus. Please know that there are no confirmed or probable cases of coronavirus in Alberta at this time, and the risk for Albertans is considered low. But as a healthcare organization, we must remain vigilant and always be prepared. In January, AHS activated a provincial emergency command center, which has representation from departments across the organization, including acute care, primary care, infection prevention and control, and public health. We're collaborating with frontline staff, physicians, departments, and partners to help ensure they are informed, sharing coronavirus information as it develops. And in short, thanks to the work of many, Albertans can rest assured that their healthcare system is well prepared to respond to any cases should coronavirus arrive in Alberta. So we are ready. Finally, I'd like to share with you that last week Alberta Health Services was named one of Alberta's top 75 employers for the third consecutive year. This comes just 3 months after we were named one of Canada's top 100 employers, also for the third straight year. The top 100 designation identifies AHS as a great place to work and a leading innovative healthcare organization focused on supportive programs for the people who work here, the patients and families they care for, and listening to and engaging with Albertans. We know excellent patient and family-centered care is attained when our people feel safe, healthy, and included in their work environment. This recognition also helps AHS recruit and retain exceptional people from within Alberta, across Canada, and internationally to help provide the best care to Albertans. I'd like to congratulate everyone who helps make AHS one of the best places to work, not only in Alberta, but in Canada. So thank you for listening today, and with that, I pass it back to David.
Thank you, Verna. We will now have some reports from our board committees and some motions being proposed. Firstly, Glenda from the Finance Committee.
Thank you very much, David. The Finance Committee met on February 12th, 2020, and the committee considered 3 items for recommendation for approval to the board. First, the third quarter 2019-20 investment report. As mandated by AHS's investment bylaw, the committee is required to receive and review reports prepared by management and investment managers, summarizing the activities and the performance of AHS's investment portfolio on a quarterly basis. The committee was presented with the third quarter 2019-20 investment report and recommended that the board ratify the transactions. The board reviewed the recommendation. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio and transactions as described below and as certified by signed investment compliance certificates from Alberta Health Services and Phillips Hager and North Investment Management. A, as at December 31st, 2019, Alberta Health Services held restricted and unrestricted funds managed by Phillips Hager and North Investment Management and Manulife Financial, totaling $0.914 billion. B, the funds were invested in short-term treasury bills, federal, provincial, municipal, and corporate fixed income bonds, pooled mortgage funds, bond funds, Canadian and global equity funds. And C, all of the funds invested during the quarter ended December 31st, 2019, were invested in accordance with the investment bylaw and investments policy as certified by signed investment compliance certificates from Alberta Health Services and Phillips Hager and North Investment Management. I'll move this motion, and I'd be looking for a seconder. All in favor? Maybe you asked that, sorry. Thank you. Secondly, the committee reviewed a contract amendment with Direct Energy Marketing Limited. The committee made such recommendation and the board supports the approval. Accordingly, I move that the Alberta Health Services Board, A, approve the amendment to the current contract with Direct Energy Marketing Limited, which exercises the 2-year renewal option from May 1st, 2020 to April 30th, 2022, adds or removes sites from the agreement, and amends the agreement to formalize the process for future site additions removals with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. And B, delegate authority to the President and CEO to execute this renewal and amendment on behalf of Alberta Health Services in accordance with Policy 1100, Delegation of Authority and Establishment of Controls for Commitments. I so move.
Do we have a seconder? Dr. Hemmelgarn, thank you. All in favor? Carried.
Thirdly, the committee was asked to consider and recommend board approval for amended restricted grant agreements over $90 million relating to the Academic Medicine and Health Services Program Grant Amendment. Accordingly, I move that the Alberta Health Services Board, A, approve the following Alberta Health Grant amending agreements with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. 1, the provision of insured medical services and education, research, and leadership administrative services at the University of Calgary and at Alberta Health Services facilities by physicians participating in the Academic Medicine and Health Services program for the term July 1st, 2017 to March 31st, 2021. And 2, the provision of clinical services and non-clinical services at the University of Alberta and at Alberta Health Services facilities by physicians participating in the Academic Medicine and Health Services program for the term July 1st, 2017 to March 31st, 2021, and B, delegate authority to the President and CEO to sign these agreements on behalf of AHS in accordance with AHS Policy 1100, Delegation of Authority and Establishment of Controls for Commitments. I so move.
Thank you, Glenda. Seconder. Thank you, Heidi. All in favor? Carried.
Thank you, Mr. Chair. That concludes my finance report.
Thank you. Are you ready to give an audit and risk report as well?
I am, Mr. Chair.
Thank you.
The Audit and Risk Committee met on February 12th, 2020. Standard practice is that the Office of the Auditor General and KPMG are guests at the meeting in their role as external auditors of AHS. The committee reviewed and supported the submission of the Q3 2019-20 financial report to Alberta Health. The committee also received a quarterly Enterprise Risk Management Report, the Internal Audit and Enterprise Risk Management Quarterly Performance Report, which provides an outline of the portfolio's progress and an update from Legal and Privacy. There were no items that came through from the committee to the board for approval.
Great. Thank you. Do you want to make it 3 in a row? Glenda?
Certainly.
For the Quality and Safety Committee, please.
The Quality and Safety Committee had a teleconference meeting on February 12, 2020. The committee's meetings focus on the 3 areas of access, quality, and safety. The committee received a report on establishing safer alternatives for transport of patients with high oxygen needs, an update on the Alberta Surgical Initiative, and an update on emergency department wait times in the Edmonton zone. The committee also received a semi-annual report on strategic initiatives of the organization with a specific focus on the Provincial Intensive Care Unit Delirium Initiative. There were no items recommended for board approval.
Thank you, Glenda. Hugh, you have a report and a motion for us for the Governance Committee.
Thank you, Mr. Chair. The Governance Committee met on February 13th, 2020. The committee received the results of the Accreditation Canada Fall 2019 on-site survey. The results were very positive. All governance standard criteria were rated as met. The committee also received the 2019-2020 Q3 report of the Ethics and Compliance Office, the results of the Board Skills and Competencies Matrix, and an update on the policy standardization work. The committee commenced a review of the current board committee structure, and follow-up discussions will continue at future meetings. The committee considered proposed amendments to the board member remuneration, expense reimbursement, and ongoing education procedure, and recommended that the board approve the same. Accordingly, I move that the Alberta Health Services Board approve the amendments to the board member remuneration, expense reimbursement, and ongoing education procedure with such non-substantive changes that may be considered necessary or advisable, and direct the corporate secretary to post the amended procedure on the AHS public website. I so move.
Thank you, Hugh. May I have a seconder? Thank you, Brenda. All in favor? Carried.
That concludes the governance report. Thank you.
I appreciate that. Thank you. Brenda, a report from the Community Engagement Committee.
Thank you, Mr. Chair. The Community Engagement Committee met on February 13th, 2020. The President and CEO and Board Chair of the Mental Health Foundation attended the meeting. The Chair of the David Thompson Health Advisory Council also attended the meeting. The committee considered two items for recommendation for approval of the board: appointments and renewals of members to advisory councils, including chair appointments, and appointments of trustees to foundations. We're very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to health care. Given the number of appointments and renewals, their names will not be read at this meeting, but will be incorporated into the minutes of the meeting and posted publicly. First are the appointments and renewals of members to advisory councils. The committee considered appointments and renewals to advisory councils and the appointment of the chair of the Seniors and Continuing Care Provincial Advisory Council. The responsibility to appoint or renew these council members lies with the AHS board. The committee recommend the board approve the member appointments and renewals as reviewed by the committee. The board has considered such recommendations. Accordingly, I move that the Alberta Health Services Board approve the appointments and renewals of members to advisory councils and the appointment of the chair for the Seniors and Continuing Care Provincial Advisory Council for the terms reviewed by the committee and Alberta Health Services Board. I so move.
Thank you. May I have a seconder? Thank you, Hugh. All in favor? Carried. Thank you.
And second, with respect to the appointment of trustees to foundations, the responsibility to appoint trustees to established foundations also lies with the Alberta Health Services Board. The committee recommended the board approve trustee appointments as reviewed by the committee, and the board has considered such recommendation. Accordingly, I move that the Alberta Health Services Board approve the appointment of trustees to health foundations for the terms reviewed by the committee and the Alberta Health Services Board. I so move.
Thank you. Second? Heidi? All in favor? Carried.
And that concludes my report.
Thank you for that report. That also concludes the business meeting. May I have a motion to adjourn? Hugh, thank you. We're concluded.
Together, we do amazing things every day.